Okay, so hello everyone, welcome. Thank you for attending. My name is Cynthia. I'm a foot care nurse. I've been a nurse for about 6 years now, um, and about almost the full 6 years I've been doing foot care. Um, so we'll jump right into it. And today's topic is taking care of your feet. Okay, so healthy feet are happy feet. So just a quick breakdown of what's going to be included today. We'll go over some facts about feet, and then we'll jump right into assessing the feet, what to check for and keep an eye out for, how to do your foot care if you don't currently have anyone doing your foot care for you. We'll go over some tips and tricks. And then all the common foot care problems that I see in my practice. And then last but not least, we'll go over diabetes because it can affect the feet quite a bit. So the feet are quite complex structures. About 75% of Canadians will experience at least one foot problem in their lifetime. We put our feet through a lot. They carry us around our whole lives, and we walk. The average person walks about 160,000 kilometers in their lifetime. So that's about 4 times around the world, or works out to about 6.5 kilometers of walking per day. So we're on our feet quite a lot. We have 26 bones in each foot. And so if you count for both, that's 52 bones total. So that's about a quarter of our bones are just in our feet alone. We have 33 joints and over 100 ligaments, muscles, and tendons in the feet combined. So the feet are quite complex, and it leaves a lot of room for things to go wrong with our feet. So when you're at home, I recommend checking the feet every day. You want to check for any cuts, blisters, sores. You want to look at the color of the feet. Are they the usual color, or are they starting to look blue, purple, or red? Any of those color changes could mean there might be some circulation problems. The temperature is another important one to feel with the back of your hand. A lot of times people will have neuropathy, and what neuropathy is that numbness or lack of feeling in your feet, because certain conditions like diabetes or even pinched nerves in the back or chemotherapy can all cause altered feeling with our nerves in our feet. And what ends up happening is that it can actually make our feet feel cold, even though they're not. And a lot of times I see people will use heating pads or soak their feet in hot water to try and warm them up, and they actually burn their feet because of the temperature being too hot. So that's always something to keep in mind. If you have any new swelling, you may need something like a compression sock, or may need some diuretics like Lasix to help get rid of that extra water retention. If you have any new pain, obviously if you have something like arthritis, something that you live with, and there are things that you can do to have a better quality of life. But if you have all of a sudden some kind of new sharp pain, that's definitely something to get looked at. And again, always want to keep in the back of your mind if you have any of numbness or lack of feeling, because if you step on something or if a wound starts developing, you may not feel it. Also want to take a look at the skin integrity, especially between the toes. This is the most common spot I find with my foot care clients that have skin breakdown. And that's because the toes are really close together. Moisture gets trapped in there. We have our feet in socks and shoes all day. So it becomes an environment where bacteria and fungus tend to thrive. So things like athlete's foot are quite common. And it can be hard to reach and see the feet, especially as we get older. So one thing that you can do is when you take the shoes and socks off, just check the socks, make sure there's no blood or pus or anything on there. I usually recommend white socks so you can see if there's anything on the socks. And just take a look in the shoes, see if there's any wear marks. And that can kind of give you a little bit more insight to where there may or potentially could be a problem. You can always try using a mirror, magnifying glass to kind of allow you to see the feet better. Or you can even try and setting up your phone, lean it up against something, set it on a timer to take a picture of the bottom of your foot. And then that way you can zoom in on the picture, and that could give you a little bit more insight to how the feet are looking. And also you could always ask a family member just to check the feet every once in a while, just to make sure that nothing's going wrong. And the sooner you find something and get it looked at and treated, the better the outcome. So I definitely would recommend doing a quick foot check every day. So completing your foot care at home, if you don't currently see a foot care nurse or chiropodist, the most important thing is if you don't currently have any troubles with things like ingrown nails, you want to trim the nails straight as across as possible. Don't trim them too short, and file the sharp corners. It can be hard because a lot of the nail clippers that are out there are rounded, and our toes are naturally rounded. So the biggest thing is to just try and not cut down the corners too deep, because then that can lead to things like ingrown nails. Or don't push or cut the cuticles. Our cuticles are there as a natural barrier to prevent bacteria and dirt from getting in. So we don't recommend that. You want to file calluses and corns, dry skin with either a foot file or pumice stone. Don't use scissors or razor blades. I've seen quite a few people get quite the sores from using that. So it's a lot safer to use a foot file or a pumice stone. You want to apply lotion daily, especially if the feet are really dry, just not between the toes. And again, because the toes are the higher risk areas for skin breakdown because of too much moisture. And washing the feet daily and drying well is important. If you can't get down between the toes very well, you can always take a longer ruler, wrap a washcloth around it, and have one in the shower so you can use some soap and water to get in between, and then have one with a dry cloth to be able to dry the toes well in between. And if you find that you do have sweaty feet or between the toes, there's too much moisture in between, you can always use a little bit of foot powder, Tinactin foot powder. You can buy it off the shelf at drugstores. It's an antifungal foot powder and it works quite well as well. Footwear is quite important. You want to consider the length, width, and depth. Depth becomes really important if you have hammer toes. And so hammer toes is when the joints of the toe kind of seize and it starts to bend and stay bent. You want a snug but not tight fit. You want to be able to still wiggle the toes. I usually recommend shopping closer to the end of the day for shoes, just because your feet do swell over the day. If possible, if you have any problems like corns, calluses, flat feet, definitely recommend professionally fitted shoes by pit orthotists that like Stride or Bioped, and also orthotics if need be. I recommend Velcro or laces, no slip-on shoes, and that's just because it gives you a little bit more room for adjustment. And when you get new shoes, you want to test drive them, wear them around the house for half an hour the first day, and then check the feet to make sure that there's no irritation or sore spots. And then, especially for anyone who has diabetes, protecting the feet is important. So we do recommend wearing shoes indoors and outdoors. The most common foot problems I run into. So I'll go over each one of them and go over some things that you can try. So calluses and corns, they're the most common that I see. They're caused by friction, rubbing, and pressure points. So the biggest thing is after a shower, when the corns, calluses are a little bit softer, that's when you can file them. Not too much all at once. It's better to do a little bit more often. And so pumice stone, foot file you can use. Then afterwards, there are lotions. I recommend a lotion with urea in it, which is an ingredient that kind of helps break down that rough, dry, dead skin. So the different kinds are Flexitol, Urasec cream. You can get that in the 10% and 22%. And you can get those at the drugstore as well. And they just help moisturize a little bit better on those thick, dry areas. Nail fungus. So it's actually quite common. About 1 in 5 Canadians have it. The biggest thing is they can get quite thick. So having them filed down by someone, by a foot care nurse or someone, a foot care specialist would be important, just because sometimes when they get too thick, they can press down on the nail bed. And I've actually seen wounds develop underneath the nail. Warts, they're actually caused by a virus, and they have a cauliflower appearance with little speckles. They actually develop a blood supply. So having them debrided and shaved down, and then a medication applied. Usually you can get this done in a doctor's office. If you have diabetes, I definitely recommend seeing a doctor, nurse practitioner, or foot specialist to do it. Otherwise, if you don't have diabetes, there are things you can buy like Compound W off the shelf at a drugstore as well to treat it. Next, ingrown nails. This one is, it can be a bit of a tricky one. Sometimes just coming to see us one time, we can remove the ingrown nail, file the corner, and hopefully you hope for the nail to grow back out. But sometimes we do see people who have chronic ingrown nails where if you don't cut the corner out every time, then you get chronic infections, which is what we don't want. You want to avoid that. So when it does become quite a chronic, painful problem and they constantly get infected, there is a procedure called a resection, and a chiropodist can do it. And I've actually had some clients go to the hospital to get it done. And what they do is they cut out the side of the nail that grows into the skin, and then they cauterize it so it doesn't regrow. And so that's a little bit more of a permanent solution. Dry skin is quite common. Again, after a shower, you can give the bottoms of the feet a file with a pumice stone, and then just put a lotion on over top afterwards. Cracked heels, same thing. You want to file them down every once in a while, and a lotion with urea. Sometimes they can get so bad that I've seen clients need wound care for cracked heels. So it's something you do have to keep it on top of, and it does take quite some time to get them to heal. Foot deformities. So this person here has quite a flat foot. Um, and the biggest thing is proper footwear. So this person would definitely benefit from having orthotics, just because it's putting weight on an area of the foot where not normally bears weight, and it can cause corns, calluses, all of that fun stuff to develop as well. So having proper footwear is very important. The next one are hammer toes. A lot of times genetics, or you inherit hammer toes, and basically the joint kind of starts to seize up, and it's permanently crooked, the toes. So what happens with these a lot of the times is you get corns or calluses right on top of the joints because they rub on top of your shoes. And then you also can get wounds, calluses, corns on the bottoms of the toes, because now instead of the weight being bared on the pad of the toe, it's actually being put on the very tip of the toe. So there's different things you can buy from like Shoppers Drug Mart, like toe crutches, and that just kind of keeps the tip of the toe up off of the ground to prevent wounds. And then if you do have corns or calluses on top, it'd be important to file them down every once in a while as well. Next are bunions. So same thing, can be inherited. The biggest thing is you want wide footwear to accommodate for that bunion. There are braces and spacers you can buy off the shelf, but those don't correct it. They just help with comfort. If it's become quite a problem, and same with the hammer toes, if they become quite painful and they affect your quality of life, then having surgery to correct them would be the option, more last resort option. Again, athlete's foot, quite common. I see about 10 clients every day for foot care, and at least one of them every day I come across athlete's foot. So just that skin breakdown from moisture being in between the toes, the bacteria caused by fungus tends to thrive. Then you get like the peeling skin, burning, itching kind of feeling. The skin can crack. So there's things like Tinactin foot powder, or there's a cream that you can also buy that has antifungal medication in it off the counter. And then the last one are wounds. Wounds can be quite hard to heal on the feet because when we put pressure on our feet every day by standing and walking, it makes it a lot harder for the healing process. So at the earliest sign of a wound developing, you definitely want to see your nurse practitioner, your doctor, walk-in clinic, wherever you can access care to start the treatment process in order to have them heal. Okay, so a quick question. I'll give you some time to think about it. But do you think people who have diabetes should soak their feet? On the Canadian Diabetes website, they actually recommend people who have diabetes to not soak their feet. And there's quite a few reasons for this. A lot of times with the neuropathy, diabetes can cause neuropathy, which is that altered feeling, lack of feeling in the feet, and can also make your feet feel cold when they're not. So I've seen people burn their feet by putting them in too hot of water. Excessive exposure to water can actually strip the natural oils of the feet and lead to a drier feet over time. And another thing is with soaking your feet, all the dirt and bacteria stay in that tub with your feet. Whereas if you wash your feet in a shower with soap, the dirt and bacteria gets washed away. So that is the biggest thing with soaking your feet, and it can lead to skin breakdown over time as well. So we don't recommend people who have diabetes to soak their feet. So we'll jump into how diabetes affects the feet. The two biggest things I was mentioning already is it affects the nerves in the feet, and it affects the blood vessels in our feet. So high blood sugar levels will damage our nerves, and that damage to the nerves ends up causing the numbness, burning, tingling, all those different feelings. And it affects the feet a lot because we have more nerve endings in our feet than any part of our body. So that's why our feet are quite affected. The nerves also help with the function of sweat glands. So that's why people who have diabetes tend to have drier feet as well. Every year, I recommend that you have a monofilament test done. And what that is, it's basically like a piece of fishing line, and we touch different parts of the feet with it. And it just gives you an insight to where you may or may not feel. So I recommend every year having that done. And lastly, with neuropathy, it's quite rare, but I will mention Charcot foot. In my 6 years that I've been doing foot care and in the healthcare world, I've seen it twice. So it is rare, but important to kind of know about it. So this picture of the foot you can see on this slide is Charcot foot. And what happens is that neuropathy is so bad or so severe that you can get a little dislocation or a little fracture in the foot and not feel it. You continue to walk on the foot, and it then weakens the rest of the structures around it. And you start to get this convex looking foot where all the structures start to drop down. So the early signs of this is a red hot foot in the middle. And the treatment is staying off of it. Definitely need to have a doctor treat it. And in severe cases, it would require surgery. But again, it's quite rare. So the next thing is circulation. So the blood vessels can get damaged by the high blood sugars, which will lead to poor and slow wound healing. So these two things, the impaired circulation and the neuropathy, are the two things that lead to developing diabetic foot ulcers. If you have diabetes and you have a wound on your foot, definitely seek medical treatment right away. We call them ulcers when they don't heal or they have poor healing, slow healing. St. Joseph's Care Group has a really, really good wound clinic. They have a multidisciplinary team with doctors, nurses, foot care specialists. They have a chiropodist, wound care nurses. So you don't have to be referred by a doctor. You can actually refer yourself, but you can also get a referral from your doctor too. So they'll go fit you with offloading devices like casts, boots, or if you see in the bottom right-hand corner, they can actually do some offloading devices too. So you can see that the rest of the foot is built up but the circle is left where the wound is. And so that allows you to keep that pressure off the wound to allow it to heal. And then having dressing changes, ongoing assessment by wound specialists is important. If you smoke, definitely recommend to try and cut back or quit, just because the nicotine narrows our blood vessels even more, and impairs wound healing as well. And then just having ongoing foot care is important, just to prevent any other problems with the feet. And 85% of amputations are due to non-healing ulcers. So it's definitely something to get treated right away. It's not something that you should leave. Okay, so I have another question for you. Should people who have diabetes use medicated corn and callus pads? Okay, so the answer is no, you shouldn't. The ones that aren't medicated can be beneficial just to kind of offset that pressure, those pressure points, but ones that are medicated, they have the ass in them, and they actually have a little disclaimer on the packages saying that people who have diabetes shouldn't use them, or speak to their doctor first before using them. What happens a lot of times is that the acid not only breaks down the corn or callus, it actually will break down the healthy skin that's around it, and it can cause wounds. In my practice, I've actually seen a client put a medicated corn pad on, miss the corn entirely, and put it on healthy skin, and it broke down the healthy skin. So we definitely don't recommend using the medicated ones. The best thing to do is file them down with a file or pumice stone after a shower. See a foot care specialist to have them debrided, and then look into new footwear or possible orthotics to kind of help offset those pressure points. So one more kind of question for you. You can take a few minutes, but who's at risk? Who would benefit from having foot care or seeing a specialist or foot care specialist or a doctor? All of them are definitely at risk. So image 1, as you can see here, this person has one foot and one leg that's quite more red than the other one. So to me, this would probably signify that there may be a clot or some kind of impaired circulation in the person's leg. So definitely seeing a doctor. And it's hard to see, but it does look like the nails are a little bit more thick and possibly fungal. So having them shaved down and properly trimmed, and that to prevent further wounds would be important, because if this person got a wound on that one leg, it could be quite hard to heal. The second image definitely needs some foot care. So having them filed down and using the urea-based lotion is quite important. I would recommend this person see a foot specialist at least once, just to go over the proper techniques. You can try things like liquid Band-Aid to kind of fill the cracks. If at any point they start to open and bleed, definitely putting polysporin on is important. And if they open up big enough, definitely wound care to help heal those cracks. And then image 3, so you can see there's a lot of hammer toes there, possibly a bunion starting, so that this person's quite at risk for skin breakdown, corns, calluses. and wounds as well. So this person would benefit from having well-fitting shoes, and every once in a while having the calluses and corns on top of the toes filed down, and just checking underneath the toes to make sure that there's no wounds or anything like that forming. And then I listed a couple websites here. If you need or want more information, Diabetes Canada has some really good information. The Canadian Association of Foot Care Nurses also has a list of resources if you need any more regarding foot care. And Wounds Canada, if you want to look into more information about wounds in the feet. So that concludes my presentation.